Quickly try to look at another type of test, and this test is usually done for the shoulder. So okay, this is O'Brien's test for the shoulder. Okay, so this is what is known as the O'Brien's test for shoulder. Okay, so what is the O'Brien's test for shoulder? Let's see it. It's another picture. So they also call it the O'Brien's active compression test. Okay, so O'Brien's test, also called the active compression test, is a clinical maneuver, and they try to use it to now look at if there's a labrum tear, okay, around the shoulder. Okay, so a positive one shows that if you're trying to move your hand like that, you'll be hearing some sound inside. So it's primarily used to what? Identify superior labrum, okay, tear. So it's used to also dictate, acromioclavicular joint abnormalities. So it's often performed when patient present with shoulder pain, instability, or clicking sensation. So procedure: the patient stands with the arm flexed at 90 degrees and adducted across the body, so about 10 to 15 degrees. So the arm is now first placed in full internal rotation. So the examiner applies what? Downward force. Okay, so as you are applying the force downward, you are telling the patient to resist the force you are applying. So the arm is now placed in an external rotation. The examiner again applies downward force while the patient resists. So you put your palm up, you put your palm down. All this while they are trying to push it down. Okay. So positive for labral tear, you hear a lot of the pain. The patient is complaining about pain. Patient is complaining about pain, and there's a whole lot of sound, clicking sound, pooping sound. Then the pain is present in both positions. If it's negative, there's no pain or there's no clicking, and the person is resisting the pressure accurately. So let's have it. So that's it. Okay, O'Brien's test for shoulder.